For our EBP project, we looked at the effect of topical agent dressings on the healing of pressure ulcers. According to the Agency for Healthcare Research and Quality, about 2.5 million people develop pressure ulcers in the United States per year.
Pressure ulcers are areas of damaged skin caused by staying in one position for too long. They can be staged 1 through 4 based on their circumference, location, eschar, tissue, odor, undermining, and more. There are several treatments for pressure ulcers that are listed below.
The PICO question we developed is, in patients with pressure ulcers, what is the effect of topical agent dressings on the promotion of wound healing?
Topical agent dressings are just one way that help in the healing process of pressure ulcers. Topical wound agents are preparations such as creams, emulsions, oils, and sprays formulated for wounds in dermatologic conditions. Topical agents indicated for wounds generally provide moisture to the wound bed and may also support autolytic debridement or reduce odor.
When conducting research for this assignment, we used databases from the University of Cincinnati Library such as CINAHL, Medline, and PubMed. The limits we chose were the English language and being published within the last 5 years, and then we used these specific keywords to refine our search more.
Within this first article that was analyzed, the researchers looked to test the hypothesis that hydrocolloid dressings are more effective than hydrocellular dressings in healing Category 2 pressure ulcers. This was a randomized controlled trial that consisted of 169 patients with pressure ulcers in primary and long-term care institutions. It was a Level 1 and Quality B article. Ultimately, the results found that hydrocellular dressings were more effective in the healing time and patient usability. Hydrocellular dressings were seen to be less painful and helped in the promotion of healing time.
Our next article was a Level 2 Quality B article, and the purpose was to evaluate the effectiveness of hydrocolloid dressings and ceramide dressings in the healing of pressure ulcers. Relevant findings from this article were ceramide dressings are found to be more effective in reducing erythema and improving the healing of pressure ulcers when compared to ordinary hydrocolloid dressings. Ceramide dressings also reduce the friction of the skin and balance the skin pH, as well as protecting the skin from infection by acting as a cushion.
The third article included in this study is Role of Local Application of Autologous Platelet-Rich Plasma in the Management of Pressure Ulcers in Spinal Cord Injury Patients. In this study, researchers applied autologous platelet-rich plasma to one pressure wound and a normal saline dressing to another pressure wound on the same patient to compare the differences in the healing of each ulcer. The population involved was 25 spinal cord injury patients, each with 2 or more pressure ulcers. Some relevant findings that we noticed were that there was a significant decrease in the surface area of the pressure wound treated with the autologous platelet-rich plasma. These wounds also showed greater improvement in healing, with 24 wounds improving versus the 17 that improved with normal saline.
The final article we looked at was a Level 1 B-quality systematic review with meta-analysis of randomized controlled trials. A systematic review provides a summary of current evidence relevant to a research question at hand. This study's focus was the comparison of the treatment of hydrocolloid dressings and normal saline gauze dressings for pressure ulcers. This article pulled results from 7 different studies to come to the conclusion and answer their research question that there is indeed a significant association between the use of hydrocolloid dressings and pressure ulcer healing. We discussed our articles to synthesize the evidence we all found on our own in the attempt to answer our PICO question. We were able to infer that topical agent dressings treat pressure ulcers more effectively than the typical standard practice of using saline gauze dressings. However, our evidence was not consistent enough to provide a definitive answer on which specific type of topical agent dressing is best to use in clinical practice.
Our recommendations for practice are as follows. Nurses need to conduct further research on the specific type of dressing that will help in the treatment of pressure ulcers, and nurses also should use topical agent dressings over normal saline.
If we were to suggest a change in the facility's standard practice for the care of pressure ulcers, we would recommend the use of hydrocellular or ceramide-containing topical agent dressings. These 2 dressings proved more effective than the hydrocolloid and platelet-rich plasma topical agent dressings. Although these were less effective than hydrocellular and ceramide-containing dressings, the 2 topical agent dressings still proved to be significantly associated with the healing of pressure ulcers.